How do different macronutrients affect insulin? This is the proportion of macronutrients that are eaten around the world, and we have the proportion of carbohydrates, protein and fat, and carbohydrates making up the majority of the macronutrients eaten. When we look at the effect of insulin, fat has very limited or no effect on insulin. Protein has a small effect, and carbohydrates have a large effect. Looking at it in a slightly different view, this is the effect that it has on insulin, and it's not necessarily declaring a war on carbohydrates because the type of carbohydrates do matter. But when we acknowledge that hyperinsulinemia is the cause of insulin resistance, then one of these diets, and what we eat the majority of, is going to be better at removing the offending agent. And in diabetes, the molecule that the body struggles most with is glucose. And that is what the body turns carbohydrates into when it's ingested. So it's the one we are eating most of. And it's the one that we can do the most about. And in this very helpful infographic by Dr. David Unwin, we can see the types of foods that have the highest impact of carbohydrate content, and therefore what that turns into glucose in the body. And when we consider that the body only needs 1 teaspoon of sugar, this is 4 grams of sugar, and the body can make that itself in the liver. When we look at some of these types of foods, we can see the impact that that can have in terms of overloading the body and causing an increase in insulin to have to be secreted to deal with this influx of sugar.